mentioned earlier on, bone health, very, very important. I think, one of my patients recently joked with me and said, I have so much extra bone and yet I've managed to fracture. So how? But yeah, that's actually because, as I've mentioned before, the quality of the extra excess bone is actually not normal, good quality bone. It's actually fairly brittle bone. And so the inflammation process in the body itself leaches out a lot of calcium from the surrounding bone, and that also causes osteoporosis. Okay, inflammation, as I've mentioned earlier on, increases your risk of atherosclerosis and accelerates atherosclerosis, the stiffening and narrowing of your blood vessels. And so please do control your cardiovascular risk factors by exercising, by controlling your cholesterol, blood sugars, and any other modifiable risk factors such as smoking and your weight, and make sure to eat a balanced diet. And so now in the era of COVID-19, of course, a lot of patients will then ask, so how can I manage my AS differently compared to, when it's not COVID-19? I suppose if your ankylosing spondylitis is stable, and, please discuss this with your rheumatologists. If you are deemed stable and suitable, then perhaps scheduling a telehealth visits to minimize exposure to COVID in the hospital and in the community would be good. Do practice social distancing, wear masks when you leave the house or whenever you have visitors. Make sure to eat healthily, get enough sleep, drink enough water, and consider the vaccine. And so, yes, I have a special slide for vaccinations because it's weighing on a lot of people's minds these days. So in general, having AS does not stop you from going for vaccinations. However, there are caveats to this. So if you are allergic to a vaccine or any components of a vaccine, then please do not go ahead with it. If the vaccine is what we call a live vaccine, meaning the virus is still alive inside of the vaccine, there is a potential risk of actually getting the infection from the vaccine. And so if you have to go for a live vaccine, be it a chickenpox vaccine or yellow fever vaccine, for example, if work requires you to travel to those areas, then you must check with your rheumatologist whether it is okay or not, because some of the medications that you're on, things like methotrexate for peripheral joint involvement, or if you're on biologics, would preclude you from getting the vaccines, meaning live vaccines are a big no-no for this group of patients. Okay. Being on the non-steroid anti-inflammatory drugs does not stop you from going for the vaccines. In fact, it has no effect whatsoever on the efficacy of the vaccine, so can carry on. While on immunosuppressants, the vaccines may not confer as much protection as, if you were not on the medications or in individuals who are not on the medications, but do not stop medications without asking your rheumatologist because you may actually induce a flare. And for certain biologics, there may be a need to coordinate the timing of the vaccine and the biologic. So if you are going to schedule your appointment, perhaps discuss this with your rheumatologist.